data has evolved demonstrating that homologous recombination repair pathway alterations are prevalent in advanced prostate cancer. Certainly, there is a role in the CRPC setting for PARP inhibition to treat these patients. However, the prognostic utility of the presence of homologous recombination repair pathway alterations in the hormone-sensitive setting has not been fully defined. So the primary objective of this analysis was to assess the time from diagnosis of metastatic hormone-sensitive prostate cancer to onset of castration resistance in patients with either somatic or germline homologous recombination repair alterations compared to those lacking such gene alterations. So we conducted a single center retrospective analysis of men with metastatic HSPC who underwent next generation sequencing between 2015 to 2020. And all patients had undergone somatic tumor profiling, with a subset of patients who had undergone germline profiling. And we focused on a panel of homologous recombination genes. What we basically demonstrated was that so first off, when we looked at baseline characteristics between the group, looking at the homologous recombination deficient group compared to wild type, there did appear to be similarities, with regards to age, race, disease status at diagnosis, whether somebody was metastatic or de novo, similarities between groups regarding Leeson score and PSA, and also similarities with regards to site of metastasis. So, there did not appear to be a baseline characteristic that really stood out in the HRD group compared to the wild type group. The most common alterations that we observed were alterations in BRCA2 at 38%, followed by ATM, CDK12, CHEK2, BRCA1, RAD50, and, other gene alterations. Again, 100% of patients had undergone somatic tumor profiling that was derived from tissue in 45% of patients, and then 25% of patients had cell-free DNA only, and then 30% of patients had both tissue and cell-free DNA, and 60% of patients in the cohort had homologous recombination, or 60% of patients in the cohort had germline defects. Overall, 24.5% had homologous recombination alterations that were detected, so about a quarter, which is in line with what we see across other disease states. In aggregate, we basically demonstrate that time to CRPC was shortened in patients who have homologous recombination gene alterations. I think this is important as we think of designing and developing therapeutic strategies for hormone-sensitive disease with potentially early use of PARP inhibitors for patients who have hormone-sensitive disease, really understanding the behavior of that biomarker in that specific context. So compared to patients who don't have this alteration, it seems like the presence of homologous recombination deficiency resulted in a shorter time to castration resistance.